Thank you for choosing this training video as part of your quest for more knowledge and expertise in combating human trafficking. I am Professor Rosa Patti. Our Human Trafficking Academy has designed these training videos to benefit law enforcement, legal professionals, educators, healthcare professionals, religious organizations, and the community at large. The experts featured in them dig deeper into the efforts made by the government, the public sector, and civil society working together in partnership to raise awareness about trafficking in human beings, to assess and address the root causes that make people vulnerable, to understand the intricate structure of the crime and the modus operandi of its perpetrators, to curb the demand of this billions of dollars illicit industry, to identify, rescue, and protect the victims and their families, and above all, to rehabilitate our society and steer it towards a more ethical and compassionate coexistence. Trafficking in human beings, modern-day slavery, is the worst affront to the dignity of the human person. It's an infamy that poisons the human society. But it does not have to accompany us perpetually. We can and should put an end to it. This is our lifetime trial, and we are never tried beyond our strengths. And now I invite you to hear from those who are at the forefront of eradicating this human-by-human exploitation and have made combating trafficking their life's most noble cause.
Human trafficking is basically modern-day slavery. It's the exploitation of people for profit through labor or sexual practices. And if you're a minor in the United States under the age of 18 who is being commercially sexually exploited, then you are defined as a victim of human trafficking. I have a patient who was about 12 when she started to come see me in the teen clinic. At about age 14 is when I realized, asked the appropriate questions, and found out that she was being commercially sexually exploited as a domestic minor victim of sex trafficking. She came in and out of our clinic, got very sick, had many pregnancies, sexually transmitted infections, and abortions. But through it all, she always came back to us. She had gone in and out of jail and juvenile hall through numerous exploiters. You know, we got her some resources, we got her some help that she could access. And sometimes those relationships didn't work out. But every time she encountered a problem, she would come back to find us and see us.
Human trafficking is the hidden epidemic, is something that's happening all around us. Indentured servitude, a sex slave. We need to be very, very sharp intellectually. We have to be open as far as our minds as clinicians, whether it's the pre-hospital paramedics or emergency physicians or in urgent care centers, to make sure that we suspect and ask and document for each of those patients that come through our doors to provide the best care for those human beings.
When you think about who's at risk of being trafficked, you think about marginalized populations, people who are outsiders of the dominant mainstream culture, immigrants and refugees, people who don't speak the language in the area where they live, people who are new to the area, children who are runaways or who don't have a stable home life, children or adults who had been abused or traumatized or assaulted in the past or sexually assaulted in the past, who have history of trauma. These are some of the risk factors.
They may be malnourished, they may be emaciated, they may be thin, their skin on bone. They may have recurrent bouts of illness. They may have commonly transmitted diseases like hepatitis C or hepatitis B. They may have syphilis. They may have gonorrhea. They may have chlamydia. These are all the sexually transmitted diseases where for the sex slaves, that is definitely a red flag, especially if they're under 18.
Sometimes they come in injured, assaulted, bruises, injuries. We ask them what's going on in their life. We always ask if there's any abuse or violence that's happening to them. We ask them if they have ever been asked to trade sex or any sexual act for something of value, and we give them examples. We ask them if they know anybody who has ever traded sex for something, whether it's shelter, food, electronic goods, jewelry, money. When you do a history of a patient, I think in identifying someone who is at risk of being a victim of human trafficking, the most important historical questions you're going to ask are the social history, the occupational history, and probably the immigration history, if they're not from the United States. I also ask if they have new tattoos. I ask them, what does it mean? What does your tattoo mean? Or how did you get the money to get that tattoo? Or who gave you that tattoo? Tattoos are a very important sign for the patient because it means something to them. And so you want to find out what it means to them.
Human trafficking involves many circumstances that might lead to the individual that been victimized to develop many symptoms and many mental health conditions that goes into the detrimental, such as depression, anxiety, post-traumatic stress disorder, low self-esteem. Actually, the whole spectrum of victimization and torture sometimes that involve being trafficked goes and damage the mental health of the individual.
They may be foreign nationals, they may not speak the language, they're always afraid of going back to their home country, they don't have a visa, they may not be able to earn a living on their own because they don't have a social security number, so they're trapped.
Patients who have been traumatized or abused or have been trafficked don't have any relationships in their current life with people who they can trust. So oftentimes they come in with the mindset of not trusting anyone. So being non-judgmental is probably the first step of establishing trust with your patients, especially patients who are at risk of exploitation and human trafficking. You have to keep your word. If you say you're going to do something, you do it. If you say that you're going to treat them for their infection or give them a pregnancy test, then you do it. You assure confidentiality. You don't break that. And if there's a potential for breaking that confidentiality, you have to let them know up front that we will maintain confidentiality from your parents, from your friends, from your peers, from your other relatives. But if we think that you are at risk of being injured or at risk of harming yourself or other people, then we have to break that confidentiality. We say that up front so that they know what the expectations are.
In the emergency department, developing trust from those victims of human trafficking is probably one of the most difficult things that we can do, because we have to assure them that if they actually open up and start talking to us about their health, where they eat, how they live, what they're forced to do, what their remuneration is, maybe drugs, they maybe be forced to be addicted to drugs, they're getting paid with drugs. Once we start talking to them, if they start opening up, then we start communicating with them, telling them, yes, you are a victim. Yes, we can provide you with shelter. Yes, we can provide you with medical care. Yes, we could take care of you away from that person that you've developed that unhealthy emotional and physical bond with. So once we start developing that communication level, then we actually can start gathering some of the forensic evidence as far as pictures of where the burns or the bruises are, and then start talking to them about their dental care, their nutrition, and so on and so forth.
Once a patient is identified as a victim of human trafficking, you have to take into consideration whether the patient is a minor or an adult. If the patient is a minor, you must ensure that the patient is safe, ensure that their medical needs are met, and report to the authorities. If the patient is an adult, again, you must ensure safety, ensure that their basic needs are met and their medical needs are met. And depending on your state, you might have to do a mandated report, and in some states you might have to get informed consent in order to make a report. In both cases, you must always identify resources for social services.
Florida law now for emergency physicians and also for emergency nurses, especially paramedics and pre-hospital providers, has broadened the definition as far as child abuse. So technically, anybody is a victim of human trafficking that is a sex slave or suspected sex slave and or has had battery committed on them, we can report those cases by law as it has broadened, because the perpetrator doesn't have to be a family member anymore. It can be anyone. So if anybody crosses the threshold of any emergency department that is under 18 years old, and we suspect that they may have any of the abuse signs and symptoms, whether it's emotional or physical, we are obligated to report it under the new law in the state of Florida.
The best practices that might be implemented by organizations that are providing services, confidentiality. Confidentiality is big when we work with this type of population because the nature of the issue. Second, being culturally sensitive and ensure that the services that we provide respect the worldviews of the individual and that understand the cultural values that these individuals are bringing into our organization. We need to be extremely careful of the culture and behaviors that are associated with the culture and not with any type of pathology.
A lot of times we forget that there are harms on the psychological side that occur, and we tend to look only at the physical ailments. But the long-term psychological effects are still present and affect the patients in their daily lives as well. Don't just view the patient as a difficult patient or a trouble patient. There are underlying issues that inform the behavior that the patient has in the center. So it's being very patient with them and non-judgmental.
I think one of the most important things as far as emergency medicine is to know what the community resources are. It is very, very important when we identify the victims of human trafficking to be able to access law enforcement, the legal system, case management, social services, domestic violence shelters, and or shelters that are specific for human trafficking victims. All of these things have to be at our fingertips that we can appropriately place that person that we suspect may be a victim and make sure that that person gets the appropriate care in the proper environment in our community.
When you have to work with different patients who speak different languages, it is always best to use an interpreter who is not related and who does not accompany the patient. Don't use the family member, the auntie or the uncle or the friend who comes to the health center with the patient. Get an objective third-party person. That's the first thing. If you can't do it in person with a face-to-face interpretation, use a phone service. That's not the most optimal, but it's better than having someone who accompanies the patient to interpret, because you don't know what that relationship is between the patient and the person who comes with the patient to the clinic. The importance of the healthcare profession in human trafficking is that we have long-term relationship with our patients and we're there in the community. They know how to access our resources. They're coming in to see us. As a doctor, I might see a patient who is currently being trafficked, and I could be the first responder to that abuse and violence in their life. Or I could see the patient after they have transitioned out of exploitation, but they still have ongoing recovery needs for physical health as well as mental health care needs. I also have the opportunity to provide prevention and education on what that might look like to community members who are at risk. So doctors, healthcare professionals, nurses have the opportunity to address human trafficking from the prevention, from the intervention stages, and the long-term recovery.
The healthcare providers have to have their antennas up to look for the red flags that would actually trigger the healthcare provider's response to that victim or to that person, so that they document appropriately, so that they can provide shelter and care for that person away from the abusive environment and or the human trafficking part of the environment.